Hello everyone, thanks so much for joining me today and welcome back to Time with Lydia, the pharmacist. Recently there's been a rise in the cases of Strep A infection. So I thought I would come over so we can have a little chat on what Strep A is all about. We are going to be looking at what Strep A is, some symptoms that you need to look out for, things that you can do to give yourself some comfort whilst you're on antibiotics, and also things you can do to prevent Strep A infection. Strep A is also known as streptococcus pyogenes, and this bacteria lives in the nose, the throat, and can also be found on the skin. You can get the infection from someone who is sick with Strep A bacteria or is a carrier of it. The infection is known as strep throat. Many people carry the Strep A bacteria harmlessly without even knowing, but they can spread it to others who might become ill. How do you catch Strep A? People can catch it through close contact and from coughs and sneezes. Outbreaks can sometimes happen in places like schools and care homes. Most people don't get extremely sick from this infection, but it can sometimes cause a serious illness and complications. Like other infections, strep throat spreads through close contact. When people who are sick cough or sneeze, they release droplets that hold the bacteria into the air. You can infect yourself if you touch something a person with strep has coughed or sneezed upon, and then brush your eyes, your nose, or your mouth with your hand. You can also get sick if you share a glass or other personal items with someone who has strep. Strep is most common in children and teens, but adults sometimes get it too. Now let's talk about the symptoms of Strep A. A sore throat is the main sign that you or your child has strep infection. Be aware that colds and other viruses can also cause a sore throat. One way to tell the difference is that a virus will often cause a runny nose too. With strep, the sore throat comes on quickly and is more likely to cause other symptoms as well. Other symptoms that you are likely to experience include a fever of 101 degrees Fahrenheit or higher, or 38 degrees Celsius or higher, a swollen tonsils, pain when swallowing, swollen and or tender lymph nodes at the front of your neck, white patches in the throat, and tiny red spots on the roof of the mouth. You might experience appetite loss, stomach ache, headache, body aches, nausea, and vomiting. There can also be a rash on the body. Call your doctor immediately if you or a child in your care has these symptoms. Now let's talk about the treatment of Strep A and some home remedies that you can carry out when you experience this infection. Strep A infection is normally treated with antibiotics prescribed by your doctor, and most treatments last for 10 days. The medicine can make your symptoms go away faster and help prevent complications. So make sure you or your child takes all the doses, as stopping the medicine too early can leave some bacteria alive. These can make your child sick again or yourself sick again. Be sure to tell the doctor if your young one or yourself are allergic to any types of antibiotics. You or your young one can also take paracetamol or ibuprofen to ease the pain of strep throat and lower your temperature. And as usual, make sure you read the patient information leaflet and speak to your local community pharmacist if you're not sure about anything and you have any questions. And remember, aspirin, even though it can be used for pain and gargled when you have a sore throat, Remember, it cannot be given to children under 16 years of age. Now let's talk about home remedies that you can carry out to lessen the pain and make you feel more comfortable. The first home remedy is gargle with a glass of warm salt water as many times as possible during the day. But remember, you cannot do this for children. Number 2, suck on throat lozenges. You can purchase lozenges from the grocery shop or from your local pharmacy. And number 3, throw out your toothbrush and use a new one. Number 4, drink warm liquids such as tea and broth, and drink plenty of water to stay hydrated. Number 5, suck on something cold such as ice lollies or ice chips, as these can give you a relief in your throat. Number 6, choose soft meals that are easy to swallow, such as soups, applesauce, or oatmeal. Number 7, honey in warm tea can ease pain and inflammation, so you can try that as well. Number 8, use a humidifier and or saline nasal sprays to keep your airways moist, which will help you feel more comfortable. And number 9, get lots of rest so your body can recover from the infection. As much as possible, you want to prevent yourself as well as your young ones from developing this infection. So these are some preventive measures that you can carry out so as to accomplish this. So the first thing you can do is, if your child has Strep A, have them stay at home from school or daycare until the fever is gone and they have been on antibiotic for at least 24 hours. Same for you in the workplace. Other preventive measures include don't share cups, dishes, forks, or other personal items with someone who is sick. Ask children to cover their mouths with a tissue or sleeve whenever they cough or sneeze. And finally, have everyone in the house wash their hands or use an alcohol-based hand gel many times a day. You know, we all want to be well for Christmas. Christmas is just around the corner and you don't want to be ill, not at all. So let's all be each other's keeper. Do the little things that would prevent you spreading an infection, even a cold virus. And hopefully we would all see Christmas and celebrate it in joy. Thank you so much for joining me once again. Please remember to give this video a thumbs up. Share it with family and friends. And if you haven't yet subscribed to this channel, please hit on the subscribe button and also on the notification bell so you don't miss any of my videos. Thank you once again for your time today, and I hope to see you soon in my next video. Bye for now.